Hi, I'm Bob Falcone, CEO of the Columbus Medical Association and its affiliates. One of those affiliates is the Central Ohio Trauma System. Today is April 17th. I'd like to update you on our current status as far as the COVID-19 pandemic. Our original modeling numbers predicted at the peak of the surge between our three regions, 4, 7, and 8, we would need to have more than 9,500 hospital beds to treat the COVID peak. By mid-March, all of our hospitals in the region were at Surge 1. Remember, this is canceling elective procedures and emptying the hospital of all people who don't absolutely have to be there. Additionally, all our hospitals are ready to go to Surge 2, which is making hospital beds where they normally don't exist. For example, converting recovery rooms, endoscopy suites, waiting areas to inpatient units. Finally, by the end of March, we began planning the space and logistics for a combined Surge 3 capacity for all the three adult systems in Columbus, Ohio. You can see I'm wearing my Greater Columbus Surge Team hat, and I'm proud to say that with incredible cooperation from a whole lot of people, that facility is now up. We stood it up last Friday, and we toured our elected officials through it on Monday. At this point, it's ready to go within 72 hours notice, and it provides us with about 1,100 beds. That combination of activities have led us to the point where we could handle a surge of 9,000 patients or more. Let me remind you of the geography. The EMA Region 4 is Central Ohio. EMA Region 7 is Southeastern Ohio, and EMA Region 8 is Southeast Central Ohio. We have decided to combine our efforts to make sure that all the patients in our catchment area are appropriately cared for. That means we have shared protocols, try to standardize approaches, and have developed a central triage mechanism for our Central Ohio hospitals. This involves a behind-the-scenes call center staffed by nurses and other professionals and supported by a dedicated physician on call each day to help make sure that patients get to the right place at the right time. If you are from outside of our Central Ohio region and you have a patient to refer, use your regular line that you've always used for OSU, Mount Carmel, or Ohio Health. If it is a COVID patient, you'll be prompted to push 1. At that time, it will go to a direct line where the staff will help us get your patients to the right place. Triage may be necessary because we don't want to overload any of our hospitals, and we want to make sure that people that need to go to Ohio State because they're transplanted, for example, or people that need to go to Ohio Health because it's a known cancer patient undergoing treatment, or people that need to go to Mount Carmel, perhaps because they are having a baby and that's where they get their care. We want to make sure they get there. I will tell you that as of today, our hospitals and ICUs in the region are about half full. Specifically, as of this morning, we have 205 COVID patients. 111 of those are in the intensive care unit, and 86 of those are on a ventilator. This is not even beginning to exceed our capacity. The one concern we have is with special populations, prisoners and nursing homes. About half of those COVID patients are at Ohio State, and 70% of those patients are prisoners. Should we begin to exceed capacity, we'll start rotating those prisoners to our other hospitals. So as you know, in early March, the governor canceled the Arnold. OSU canceled its in-person classes and emptied the campus, and on the third week of March issued a stay-at-home order. We were flattening the curve to slow the spread of COVID across the state, putting less of a strain on the state's healthcare resources. I think we've succeeded. Many of us are wondering when we can go back to business as usual. Well, those plans are currently being developed. Both the President of the United States and the Governor of Ohio have issued some basic guidelines. In addition, the governor has asked the Ohio Hospital Association to put together a plan to open our hospitals in a staged fashion. That will probably mean bringing back low-resource patients, such as outpatients who need a visit or a diagnostic test, and eventually getting us to the point where we can do normal elective admissions, such as surgeries and procedures. The Ohio Hospital Association is planning to have some detail to send to the government by the end of this week, and we should have an update for you by the end of next week. I don't anticipate any of this happening before the 1st of May. In the meantime, if you have a patient that you feel needs urgent care, please call your transfer center of choice and they will arrange to get him seen. If you have someone that you think needs to be tested, again, please call your transfer center and they will connect you with the testing facility that is available. What's keeping us up at night? Well, a supply of PPE. Right now we're in good shape, but that could change if the surge goes the wrong way. We're concerned about the economy, as are all of you, and hopefully we'll have some good news on that front by the end of this month. Finally, we're concerned that all of you who provide health care are staying safe and sane during these very difficult times. Thanks. I'll see you next week.